going to perform a hygiene. And I'm going to start patient. Hi, my name is Catherine. I'll be your nurse today. Can you please state your name and date of birth? Okay, great, Mr. Smith. I'm going to be doing your NG feeding today. I'm just going to apply clean gloves and I'm going to assess your abdomen. I'm going to raise the head, raise the bed to a comfortable working height. And I'm going to lower the head of your bed. Are you feeling any pain today? Are you nauseous? Do you have any allergies? No? Okay, good. Now I'm just inspecting your abdomen to check for any distension or masses. And now I'm going to auscultate, starting in the right lower quadrant. I'm going to listen for 1 whole minute in each quadrant to make sure there are active vowel sounds. There are active vowel sounds. And now I'm going to percuss your abdomen, listening for tympani. Great. And now I'm going to lightly palpate. Let me know if there's any tenderness when I lift my hands up. And now I'm going to palpate deeply and check for any enlarged organs or masses. Okay, great. Everything feels normal. I'm just going to cover you back up. I'm going to raise the head of your bed to 30 to 45 degrees. And now I'm going to I have all my supplies and I'm going to put a chuck on top of your Johnny so I don't stain your clothes. For the sake of this video, I'm just going to show how to measure a G2. I'll start at the xiphoid process. I'm going to go up and around the ear and to the nose. And I'm just going to mark where the nose would, where it would exit the nose with a Sharpie or a piece of tape. And it seems that the patient's tube is at 58 centimeters, and I will just check in the previous charting to make sure it hasn't moved. And when the NG tube is properly in place, I will send the patient down to X-ray to make sure that the NG tube is in the stomach. And now I'm going to put 30 milliliters of air into my patient's stomach to make sure that the NG tube is not against the stomach wall. And now I'm going to be aspirating 5 to 10 cc's of contents from my patient's stomach to check the pH to make sure that the tube is still in the stomach. And you want the contents to be a yellow in absence of blood. And as I can see by my pH stick, it is about 4, which means that the stomach is, which means that the NG tube is properly placed in the stomach. So now I'm just going to remove the remaining residual from my patient's stomach to measure. And if it's anything over 250, I would notify the physician. Ready? Okay, great. The contents is below 250, so now I am just going to return it back into the patient's stomach because you don't want to lose the vital nutrients and electrolytes. I'm going to raise it or lower it to my patient's comfort. And then I'm going to grab some sterile water and I'm going to lip it because it's already open and make sure that it's not expired. I'm going to flush the tube with 30 cc's of fluid. Great. And now I'm going to be giving them their feeding. I'm going to grab a sterile syringe and I am going to check the feeding container to make sure that it is what the physician ordered and it's not expired. And now I am going to take the feeding. I'm going to pour the desired amount into my patient's stomach, raising it or lowering it to their comfort. And I have to unclamp it. And once it is 3/4 emptied and I'm about finished, I'm going to take some more sterile water and I'm going to flush it with 30 milliliters of fluid. And now that I'm done with my feeding, I'm going to clean up after my patient. I'm going to take off the chuck. I will pin the NG tube to the patient's Johnny, not with a pin, but with a clamp. And then I'm going to lower the bed. I'm going to keep their head up at 30 to 45 degrees for at least an hour to make sure that the contents stay in their stomach and they don't aspirate. And I will check up on them in about an hour. Thank you. I'm going to wash my hands.